Welcome to Community Conversations. I am today's host, Sarita Edwards. I am the co-founder and CEO of the EWE Foundation. So today we are talking about COVID, and to help us with that conversation, we have invited Dr. Pam Hudson, CEO of Crestwood Medical Center here in Huntsville, Alabama. Dr. Hudson, thank you so much for being with us today.
Well, thank you, Ms. Edwards. I appreciate the invitation.
Thank you. So we're going to just jump right into the conversation. I'd like to start really at the beginning. I guess we know that a lot of the symptoms of COVID deals with, coughing, shortness of breath, sore throat. We want to talk a little bit about the incubation timeline and, what's that process from exposure to a positive test? When should we get tested and what should we be looking for?
Okay. Well, those are all excellent questions, and it is always good to start at the beginning. And most of this information, and certainly the clarification and the details, can be found on the CDC website or the Alabama Department of Public Health website. So I would refer interested listeners to that. But in general, with a significant exposure, you can expect, if you are going to catch COVID, the incubation time frame is running between 5 and 7 and sometimes a little bit longer, but on average 7 or 8 days, to the point where if you're going to catch it and be symptomatic, you would likely to be seeing those symptoms then. The greater question, though, is what was that exposure? And in fact, I just had a question from somebody asking about a very brief contact, less than 15 minutes, both people masked outdoors, which we would consider to be a very low risk exposure, and asking what you should do in that circumstance. The answer is very simple. You should mask, monitor, continue your social distancing. It's a personal decision whether you want to separate from your intimate family group during that period of time. But if you are asymptomatic at 5 to 6 to 7 days after an exposure, then you're probably in a pretty good spot. And a low exposure doesn't require the level of self-isolation, what we would call quarantine. A high-risk exposure, let's say in a closed room, no one was wearing a mask, and you find out the next day that one or more people tested positive in that group, and you were together for more than 15 minutes, maybe you were within that 6-foot space, or it was a very tiny space, then that would be considered a much higher risk exposure, and you probably ought to quarantine for the 10 to 14 days. The CDC has just changed some guidance on that. If you're asymptomatic, 10 days may be long enough, and certainly if you become symptomatic, to get tested. One thing that's really important to note, because I hear people a lot say, well, I was exposed yesterday and I got tested today. Mm-hmm. Well, the test from today isn't going to tell you anything about what risk you had. So you can't test your way out of isolation or quarantine. And that's a really key thing. The other thing is, if you go to get a test, if you decide you need to be tested, you should be at home quarantining until you have the results. Now infected a whole lot of other people. So.
Okay. Oh, wow. That's really good information. So that was one of the questions that I wanted to ask. When a person who has tested positive, when are they safe to return to normal activity? Is it post fever? Is it once all of the symptoms are gone? Is it once they've had a negative test? What's that safe zone for them once you've actually tested positive for COVID?
Another excellent question. If you tested positive and you were never symptomatic, the CDC is now saying, and I believe the Department of Public Health is also saying, that quarantine period for an exposure and you were asymptomatic, I believe, is now 10 days. Again, the guidance changes from time to time, and they're just an update this week. If you are symptomatic and test positive, or if you're symptomatic and it's a presumptive positive. Right now, if you have the symptoms of loss of taste or smell, you're considered to be positive. Doesn't matter what the test shows. So from that point of first symptom for 10 days, that's the time period that you are felt to be infectious.
Gotcha.
If, however, you never get symptomatic and you were exposed, it's 14 days, except the CDC has just recently shortened it a bit in certain circumstances. So the other thing is if you are still actively symptomatic at the end of that period of time, that's not a safe time to go back. Some people do experience a longer illness. So you would presume if they're still actively coughing and not making improvement, that they are probably, we should assume they are infectious and they should stay home.
Gotcha. Okay. Okay. So are you aware of any long-term effects of COVID? One of the questions that we received was, even after a patient has tested negative, were we aware? And of course we are not, but I wanted to ask, are you aware of any long-term effects of COVID? Any new symptoms that may arise for a patient that maybe they didn't have prior to COVID? Have you seen any of that?
It is going to be a while before anyone can answer that question definitively. In the research and the literature, there are reports of people who have some kidney damage after COVID, some cardiac damage, some neurologic damage, but there's nothing that I'm aware of that has really identified a true post-COVID syndrome, but it is way too early. We've only been dealing with this disease for right at about a year, so there's probably much more to learn about that.
Okay, okay. So families with rare diseases, special needs children, underlying medical conditions, should they have concerns about specialty clinic appointments? At the beginning of the pandemic, a lot of doctors, I know even for our children specifically, a lot of doctors canceled the appointments. We didn't even have to, they did that for us. And some of those physicians were able to offer us telehealth, which was great. But some of them, they just said, we're going to reschedule when this thing slows up a little bit. Should families be concerned about specialty clinic appointments? Should they just follow the lead and the recommendation of those specialists?
Yes, I think that would be the very best guidance. Most of the practices initially, many of the practices stopped seeing patients in person because they didn't have the PPE, didn't have the staff protocols, and we were under a safe at home order. Over the course of the summer, many of our physicians brought full telehealth into their practices. And so that's an option for certain kinds of clinic visits, but there are some times that the provider wants to see the patient. And so you would follow all the public health measures. You should be masked, the patient should be masked. I would expect that the providers would be masked. And you can tell when you go into a store, whether you feel safe. That same sort of thing, you would expect that those clinics would be taking those precautions with good hand hygiene, no crowded waiting rooms, things like that. So most of the practices that I'm aware of have already figured out how to have patients safely in the office. And then, of course, the telehealth is always a good option.
Awesome. Okay, good stuff. One of the things that I wanted to also kind of squeeze in is, are you aware of any correlation of COVID and mental illness? There was an article a few weeks ago that I ran across that said, I want to say it was maybe somewhere, maybe London, Oxford, somewhere like that, but it spoke to 20% of patients experiencing new mental illness, mental health issues or crises about 90 days post having a positive COVID case. Are you aware of any correlation between COVID and mental illness?
I don't have any information on that.
Okay, okay. I want to really touch on a lot of the popular ones. One that's most recently come in is the vaccine, the COVID vaccine.
Yes.
And one of the questions that we've received is your thoughts on the vaccine, and is there any data to suggest that the vaccine would not be good for certain individuals if underlying medical issues or demographically? Have you heard of anything that it may not be a good fit for someone?
I have not heard anything about that, but that is exactly what the FDA panels are investigating right now. I think that by the time the vaccines are available to the general public, I believe there'll be a lot more information. Right now, the study, the original trials were some 44,000 people. but remember, the whole world is getting vaccinated now. So I think there'll be much more. My advice to folks is to follow the literature, get the facts, and then make an informed decision based on science as to whether or not the vaccine is right for you and your loved ones. Right now, there's not a whole lot of information about vaccinating children, so that's something that we'll want to keep an eye out for. However, children are not typically the population that's most at risk. So I think there'll be more coming from that standpoint. The vaccines that have been, that are up for approval have a 90 to 95% efficacy rate, which is, that's what's being reported. If true, that is excellent. Now that's after 2 doses. And then I know that one of the questions is, how many doses do you have to have?
Right.
All the vaccines I'm aware of right now are requiring 2 doses, so a starter dose and then a booster dose. Typically, and you probably have seen in the news with the first round of vaccinations in nursing homes in England, they have experienced a couple of allergic reactions. Most likely that's a reaction to the vehicle that the vaccine is in and not necessarily the vaccine, but out of an abundance of caution, when you are vaccinated, if you choose to take that route, you'll wait for about 30 minutes because that's typically when those kinds of reactions would happen. So a little bit of a logistics challenge for vaccinating large numbers of people at a time.
Right.
So first dose, and then 21 days later, you would get the next dose. And that after that second dose is typically when the kinds of symptoms are reported that are flu-like, body aches, the typical, like your body's fighting something off, which is in fact what it is doing. And it is a good sign when you have those, because it indicates that your body has recognized an intruder and is mounting that response that we hope will be, how long that lasts, I don't think we know yet, but certainly it does appear it is several months.
Okay, and just to piggyback off of the vaccine and that time frame, the 2 doses right now, do we know if that would be a one-time 2 dose? Is it something kind of like the flu vaccine where it would be recommended annually? Is there enough data to know that?
There is not enough data to know whether or not this is going to be every year or every 2 years you get your COVID booster.
Right.
With the flu, the reason every year there's another vaccine is because every year the virus mutates and it has a different immunogenicity. So you've got to, so the flu vaccine is a different vaccine every year based on what the flu bug that year looks like. We don't have any information as to whether or not the COVID virus will have that kind of mutation capability. I believe right now, and again, not quoting any study here, is the COVID virus does not appear to be mutating in such a way that it might not respond one time and forever. So still an awful lot of information to come out as we continue to vaccinate.
Okay. Well, and lastly, I just wanted to ask, we just came off Thanksgiving. We are heading into Christmas and New Year's. How can families just stay safe? We know it's recommended to hand wash and wear your mask and socially distant, but during the holiday season, how can we just stay safe even more, even for our rare family special needs? Do we need to take any extra precaution in addition to the normal recommendation? I'd like you to just close out with that.
Sure. We want everybody to make it through the holidays without getting sick, and without, if you do get sick, without infecting others. Those public health measures, the masks, I think are key. In my family, we have upgraded from the cloth mask to the medical grade mask. I've read a study or two that indicates that that's a higher level of protection. That's what we use in the hospital when we're taking care of patients. So that level of masking is a step above the cloth masks. But if you're going to use a cloth mask, make sure it's a 2-ply mask at least. Also, if you have access to an N95, that's another way to protect folks. If you can access that, that has a higher barrier, smaller barrier to the viral particles. Social distancing is important, so that staying at least 6 feet away. being outdoors whenever you can. I mean, many times at Christmas time here, we have good weather. And if weather permits, have a picnic and don't
Yeah.
go.
Right.
And don't invite people into your house that don't live in your intimate family group. And if you do, being outdoors and masking and distancing
Right.
that's a good combination of things. The other is group size. It is very difficult to be good and follow the public health measures when you have, the more people you have, the more chance you have for violations.
Right.
And you also, if you, right now, our tests are in the community are running, in people who don't even have a single symptom, are running 6 to 12% of those people are actually probably infectious.
Wow.
So if you figure you invite 10 people over, the chances are pretty good that 1 or 2 of them are infectious.
Yeah.
Okay, so the smaller you keep your group size, the easier it is to stay separate and to follow those public health measures. And so that's how I would encourage people to celebrate the holidays. If you're going to, if there's 20 people you want to gather with, break them up into 2 or 3 groups.
Right, right.
And then be very vigorous in pursuing, don't let people incorrectly wear a mask, has to cover your nose. Where do we test for COVID? We swab the back of the nose.
Right.
So to wear a mask that is like this, that's not going to do it. We got to cover here.
That's right.
And how often have you seen people who look like they're going to sneeze or cough, and they take their mask off to cough or sneeze? Well, that is the opposite of what we want the mask to do. The mask is to keep your germs in.
Yes.
And also, depending on what kind of mask, keeps everyone else's germs out.
Oh, that's so good. That is so good. Yes, that's really good. Well, we appreciate you so much for having this conversation with us. And guys, we're going to put this on our social media and on our website. And if you have any other questions about COVID, you can send an email to the foundation. We will try to get those answers for you. Again, we'd like to thank Dr. Hudson for spending this afternoon with us. And until the next conversation, we'll talk to you soon.
Great. Everybody, thank you very much for the opportunity to talk about this. It's so important. We have to take care of ourselves and our loved ones. And if we do that, we'll get through this.
Yes, ma'am.
Happy holidays.
Thank you so much, Dr. Hudson.
All right.